Hello, speech therapists. Although by now most of you may have figured out that I offer this information, the information presented in these videos, in the hopes and encouraging all the relevant individuals in the lives of persons diagnosed and suspected to use this to your advantage. Whether you are a therapist and you are treating children or people on the spectrum, or you are maybe a parent who's learning how to implement these interventions in the home yourself, or at least trying to understand what's happening when you take your child to intervention. About imitation skills specifically, we know that imitation is one of the building blocks for language and other things, but all these things are interrelated. For example, joint attention, or the ability to attend to one thing at the same time as another observer or participant, and imitation are related to pretend skills and learning how to pretend, and then learning how to imitate language, and then using, as a consequence of these things, learning how to use language creatively. So if you have a person with autism that is not yet imitating and are not yet able to communicate verbally could mean speaking, or it could mean sign language, among other communication systems. So if you have someone like this, what the first thing you want to do is teach imitation skills. And from the category of imitation skills, because you can imitate using objects, which is probably the easiest way to learn. So you have identical objects, and you do a motion, and you guide physically the child to imitate the first many times, as you provide reinforcement and praise and the things that make the person feel good as a consequence of them gradually attempting closer and closer approximations of the imitation or the movement you're presenting. And so if you start with objects, then you're going to go to gross motor actions without necessarily using an object as a referent, which makes it a little harder. And then you go into fine motor imitation, which is a little harder because you require much more dexterity and precision of movement to get things right. And then you move on to facial imitation and oral imitation skills, which eventually can lead you to imitation of speech. So do this in two ways. Teach imitation in both naturalistic, play-based, behavioral modalities, meaning learning how to provoke and reinforce imitation during periods of play. And teach imitation both in a play-based scenario and in a structured or a set of structured activities. Applied behavior analysis, ABA technologies or techniques are a good way to structure exercises, for imitation skills. So explore those. I have added resources here for you to expand your knowledge about the relationship between those fundamental milestones, such as imitation and joint attention, and the relationship to language development. I also have included a reference to the 1987 article by Loaz, in which he speaks about how he incorporates behavioral interventions with a little bit more detail in the process of teaching things like imitation. So take a look at any questions or comments or anything you want to add for everyone else to enrich this information and their knowledge on particularly imitation in this case. And see you next time.